Ladies and gentlemen, join me in welcoming Dr. Robert Kibuuka.
Good afternoon, ladies and gentlemen. My topic is about the role of policy in combating global catastrophic biological risks. I've already been introduced by the MC, Ian, so I don't want to add anything about that. So next slide. So there are a few definitions here to get us started, so that at the end of this presentation, we are all on the same page. So the first one is about, a definition of policy. So we need to know what a policy is, and there are several definitions there. But I'll just read one of the three. The rest you can read for yourself. That a policy is a law, a regulation, a procedure, administrative action, initiative, or voluntary practice of governments and other institutions. Yeah? Or maybe let me add once, a general guideline which provides clear direction to formulate specific programs. Next slide. And I think a lot has been said about GCBRs, including the definition, but I know my partner, she knows why I call her my partner, Hidia. By the time she came, I think we had already gone through the definitions and all that. Isn't it, Hidia? So probably she has not been exposed to these definitions. So in order to make sure that she's with us, so I want to read it verbatim, that GCBRs are biological risks of unprecedented scale that have the potential to cause such significant damage to human civilization that they undermine its long-term potential. Uncontrolled, the impact of a global biological catastrophic event would cause tremendous loss to life, societal instability, prolonged damage to governments and economies, damage to international relationships, and would definitely threaten global security. So that's where we are. Colleagues, you'll agree with me that definitely there is an ongoing shift in the nature of the major risks, the nature of the major risks and in society's capacity to manage them. For example, conventional risks look set to take new dimensions due to extreme weather conditions, concentrations of population increase, and so many other things are driving that. We're also seeing new hazards which are emerging, many of which are characterized by extreme uncertainty and the possibility of extensive and maybe irreversible harm. Synthetic biology is one of those tools that are being used to develop new products. So we are thinking about misuse of the technology, and this can also result into very serious issues. And so many other important technologies like production probably of vaccines, whose information can be used to cause harm. That's why we talk about dual use research of concern. Continue. Next slide. So this is just a summary of some of the things which can result into GCBRs, the health-related risks. You've had these Ebolas, the Marburgs, and so many others that we have experienced. We are currently experiencing an outbreak. I don't want to threaten you, an outbreak of Ebola in the country. And we have had several outbreaks, and you realize that so many of these, during, outbreaks, so many samples are collected from the field for purposes of diagnostics, or purposes of, coming up with the treatments and things like that, and they are kept somewhere. So this can also be manipulated into other things, and then they can be such a big problem. There's the issue of terrorism and cybercrime. We keep a lot of information in our computers, information regarding research and so many other things. This information can be hacked, and then it can be used by non-state actors to cause harm. So research too is another, and catastrophic terrorism might in future include the use of biological weapons. Let's continue. So I just want to highlight some of the relevant elements in the risk management cycle. Why am I doing this? I'm trying to underscore the need for risk assessment. Risk assessment provides very, very critical information in terms of thinking about mitigation strategies of a particular risk. You need to understand the agent from the beginning. So if you don't understand that, then you will not be able to deal with the risk decisively, meaning that your mitigation measures will be targeting something totally different. Yeah, you could be targeting a bacteria, which of course behaves differently from a virus. So the strategies, the mitigation strategies and the control measures and all that will always be different. And a risk assessment will answer the three questions: what can go wrong, how likely is it, and what are the consequences of that. Continue. Next slide. So my previous speakers have already talked about this, and I want to also talk about it briefly. It seems I saw Debbie talking about that. I saw Stephen was also alluding to this. So this is our area of focus. If we are to combat GCBRs, this is our area of concentration. We need to emphasize prevention, detection and early reporting, and then rapid response, strengthen health systems. We need to comply with the international norms, and then we need to understand the risk environment that you're in. So most importantly in this case, it is always important that before a problem occurs, we need to preempt it. So when you preempt that, then you have an opportunity to control it before it gets into the population. So you need a lot of technologies, very important technologies, which can easily detect these pathogens before they get into maybe the animal, maybe the human population. Because if they get there, then fatalities and then the control strategy, the control measures will be very, very expensive. Next slide. I want to emphasize that a catastrophe and its impact can be multiplied by both failure to recognize the issue quickly, let alone preventively, and the inability to respond effectively. So that's why I was previously talking about early detection, or preemptive, detection, so that you limit disease spread into the human population. I want to say also that just like infectious diseases, GCBRI's management requires collaboration across sectors to achieve more rapid, mutually beneficial, and effective responses. So the concept of One Health has been talked about here by somebody, I've forgotten the name. Stephen has also talked about it. So it is very critical that there has to be collaboration, coordination, communication across disciplines and across sectors, because if that is lacking, then you are not able to preempt properly the disease. Continue. Next slide. So something like this has also been presented by the previous speakers. So what I want to say, you can see where those of us who are here now, where we are in terms of vulnerability to global catastrophic risks. And that is why we have SBA Africa. You can see where the Arab countries, the Arab states are in terms of vulnerability. You can see where Africa is. So we are competing really very seriously. The Arab states, Africa, the Middle East, Asia, and the Pacific, South or Latin America. But look at the others, North America and Europe. You see where they are? And you compare with where we are. We are almost twice more vulnerable than these other people from these other regions. So what does that mean? That means maybe we have a lot of gaps in the way, preparedness, in the way we are prepared to combat these. So what do we need? I mean, where are the gaps? Is it policy? Where is the problem? You see? And this is very, very critical for us to think about. Where are we there? Where are the gaps? Next slide, please. So the Global Catastrophic Risk Index will include the indicators of our capacities and capability to reduce, meaning that our capacities and capability are very what? Very low. That is where we are. I don't know, maybe in Egypt, maybe for you, you are, I don't know. Maybe I'm lying here, but generally, as you have seen from our graph, I think there's a big problem. Continue. Some lessons from the there's no GCBR, but we draw lessons from the previous outbreaks that we have experienced. And Uganda is one of those countries that has really enjoyed, let me say enjoyed in quotes, very catastrophic, very serious outbreaks of Ebola. You name them, those which are very Ebola, Marburg, Rift Valley fever, CCHF, that is Crimean Congo hemorrhagic fever, and so many others. And now, right now, we are battling this thing. So I've been keen and I've been following somehow. So to be truly prepared, a country should prove that it can marshal and effectively use capacities, prevent, detect, and respond to a high-risk consequence biological threat. An example, Uganda, I've forgotten the years, but we had 4 back-to-back outbreaks of Ebola. And what does that mean? Are there gaps in prevention? Are there gaps in detection? Where is the problem? Why should we have these repeated, outbreaks time and again? Also want to note that since the West Africa Ebola outbreak in 2014, countries have tried to make progress in assessing health security gaps. and have begun to build new capacities. However, the GH index results, as you've seen in our graph, clearly show that few countries have exercised or tested these capacities in real-time events, which suggests there's a global lack of capabilities to stop outbreaks at the source. So I don't know if you remember, you still recall Debbie's presentation where she indicated that our preparedness is at what percentage? Was it 38 point? Eh? For which region? Oh, okay. It's 18.8. You can imagine where we are. How safe are we in case of a GCBR? You understand? And the GCBR is more disastrous than these other ones we are experiencing now. So how do you now predict a future where we have the GCBRs and we're going to be wiped out in a very, very short time? Wiped off the globe. The next slide. I also want to say that GCBRs are not well accounted for within the current country level assessments, including the WHO JEEs. I think you've heard about these JEEs, and some of you maybe have participated in these JEEs, the Joint External Evaluations. Maybe you will bear me witness. Have you really discussed about issues to do with the GCBRs? And then the IHR 2005 State Party Assessments, Annual Reporting Tool, and the OIE PVS pathways. So that is a gap there. I think we need to think about it. So I also want to say that global health security is a shared responsibility among countries, across sectors, and as a collective international security imperative. And also countries also must prioritize compliance with and adherence to international commitments and norms. So I want to emphasize that. Continue. Now, about policy. Regarding, in addressing the gaps probably we are experiencing in terms of prevention, preparedness and response to the risks. So the potential for harm posed by these risks means that the national governments have a responsibility to their citizens to proactively design and implement policy to prevent, prepare and respond to these risks. But the first step in any risk management process is to understand the risk. That's why I talked about the risk assessment process, where you clearly must understand the what? The agent, so that you are able to answer what can go wrong, how likely is it, and what are the consequences of that. And then you are able to put in place mitigation measures that will either reduce or eliminate the risk. So there can be several strategies depending on the agent that has been identified through the risk assessment process. Continue. Next. Okay. Now, the gaps. These are being drawn from the experience that I've had maybe over time. I've been observing how things are done. Could it be a problem of a policy approach? So that maybe we don't have the policies and we need new policies in place. For example, so many countries in Africa, I don't know, most of them do not have a policy on biosafety or biosecurity. I don't know if I'm lying on that, but most of their emphasis, the African countries, have been looking at biosafety in relation to genetically modified organisms, but not to this kind of threats. So that is the challenge we have. I want to say that the risk assessment, according to what I've seen, and management has been too narrow in scope. GCBRs have not been addressed. This can be very costly in times of significant change in the risk landscape that is drifting towards the GCBRs. The risks we have can drift towards the GCBRs. And if we have that narrow scope, then I think we have a problem. So what is the proposed policy action? We need to adopt a broader view on the risk and include the GCBRs. You can also have other, things that you can add on this. We need also to examine the consistency of policy across risk areas and prioritize the risk. And then we need to improve the coherence of risk management in each particular risk area. Next slide. Some people have talked about as if we sat together and developed these presentations. Public-private synergies are very critical. We are seeing regulatory reforms, privatization, and technological change are modifying the roles and responsibilities in risk management. At present, however, new roles and responsibilities are poorly defined, and complementarity between the public and private sector is overlooked. This is what has been happening. I saw the way we panicked to involve the private sector when we had an outbreak of COVID here. Oh, I think even in other countries also. We panicked, we wanted them on board. They have to manufacture sanitizers. We need masks, that is all part of the private sector. We need the vaccines, we need what, you see? So, the proposed policy action here are that we need to enhance the role of the private sector in risk management. It's not only during an outbreak, but we need to find a policy, how do we work with before, during, after an outbreak, how are they involved? There has to be some clear plans to address that. So there's need to address the issue of increasing scale through cooperation and promotion of diversity. There has to be cooperation and involvement of very many other people. Continue. This slide. I have to observe that technical expertise for extreme risks is often lacking and inconsistent. And also observe that deep subject matter expertise, particularly on technology issues, tends to reside outside the public sector. This emphasizes the need for public-private partnerships. If you need the vaccines, who makes the vaccine? Is that the public or the private sector? You get it? Also, drawing from the COVID-19 outbreak, we relied more on the what? On the private sector. Ventilators, people came up, we can make ventilators, we can make masks, and what? Because they were needed. Yeah, we can make sanitizers. But I don't know if there's those ones who converted their factories into sanitizer making are still in there because we no longer have the pandemic. Continue. There's international cooperation. I have to note here that risks will increasingly be international. Increasingly. Because these days we talk of a global village. I might be here now having the virus before it expresses itself in terms of the symptoms and things like that. And I enter Europe. I think it takes how many hours from here to Europe? Maybe to Germany, How many hours? About 8. That's less than maybe the incubation period of that particular. And you know how we travel in those planes, how many people do we have there? Then you share the virus and everybody goes to their respective places. So it is international. But currently, infectious outbreaks management is national at best. There has to be a legal framework. I know they are there, the international ones, but like the HR, the International Health Regulations of 2005, but how have they been, operationalized? You see, I think that can be part of the discussion. What are the challenges in implementing the HR 2005, especially in dealing with these international diseases? So, what's the proposed policy action? So, to achieve better sharing, we need to have better sharing of knowledge and technology across countries. And then we need to enhance international systems of surveillance and monitoring. And then we need to create and operationalize frameworks for cooperation. I think that is very important. Because there's one thing creating, but how about operationalization of that framework? Okay. Technology and research. I think technology was talked about today by Abe, and also Stephen talked about technology. That's why I said it seems we sat in the same room. So a number of technologies which have been mentioned here today have an enormous potential for improving risk monitoring and surveillance, prevention, emergence, preparedness, and response. So here, resources and skills are limited in our region, to adopt the use of these technologies compared to the developed world. See, maybe technology is also helping the developed world, to reduce their vulnerability to GCBRs. To what extent have we embraced technology in the management of our infectious diseases in Africa? Maybe maybe there's an example, but me, in our own here, I haven't really witnessed something more serious than that. So also here, we need to share these technologies across countries. We need to enhance international systems of surveillance, monitoring, and then we also need to create framework for cooperation across the networks. Next slide, please. So, in conclusion, the drivers of GCBRs and their potential consequences are not well understood or prioritized by policymakers. I don't think there are discussions in our respective countries at the table when they're developing maybe some of the policies in the ministries of health, in the Ministry of Agriculture, and other related ministries or sectors, where they talk about GCBRs. I'll be happy to hear feedback from the members on that. National governments and international community have proven unprepared to combat naturally emerging regional epidemics. They are even less prepared for potential future global pandemics, including deliberate or accidental high-consequence biological events that could be unprecedented in scale. GCBRs pose a daunting challenge, and meaningful reduction of these risks will require concerted efforts by governments, international organizations, civil society, and the private sector through well-thought-out policies. Next slide. Thank you so much for listening to me. That ends my story.
Thank you very much, Dr. Kibuuka. Do we have any questions here?
Thank you for your presentation. I would like to know, in your presentation, you have said the risk factor of GCBR. For majority, you have said the infection disease. I would like to say if the risk environment, for example, flooding or incendie, can conduct in other disease, we can consider them comme GCBR.
Yes, thank you for that observation. Yes, I've talked about infectious diseases because those are the ones that maybe people would understand more. Floods, yes, but they are not very direct, but they can contribute. You know, they can provide an environment for GCBRs to come up, I think. Fire? Maybe indirectly, maybe. Can you explain that? Fire? Hey. Fire?
Yes.
An example of fire, say you have wheat crop. You're trying to kill the wheat crop. The fire. It sets the fire right forward from the wheat crop.
Yes. 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 Then. Yes, that one is also. Like I said, they could not be direct, but they are indirect. But the pathogens, these ones normally handle them, and they can easily be manipulated very easily into something new, and then we get a problem out of them. So that's why I put them at a higher level compared to these other ones.
Okay, the second question is after the Ebola disease in West Africa, many countries have put to the Center of Emerging Operation. I don't know if you know this. The Center of Emerging Operation, he can control.
The emergency operation centers, you know about that?
Okay.
Yes, that was a recommendation from, is it WHO?
Yes.
Yes. But are they operational?
Yes,
they are called?
because the policy action is most same for this. I would like to do a comparison of the different structures. It's okay.
Yeah. Yes,
You have anything?
No. I think
no. I would like to do the difference between GCBR and COU. The different structures.
Oh, okay. What's the difference between the emergency operation centers and the GCBRs?
Yes.
Somebody can, because that is a center. It's a coordination unit, isn't it? It's a coordination unit that would, if receive information regarding maybe a GCBR or maybe an outbreak or a potential outbreak, and then mobilize probably resources, which can be finance or human resource, to be able to go out and then respond to that particular outbreak or the GCBR. You wanted to?
Yes, thanks, Robert. I don't have a question, just a contribution and sharing my experience regarding your presentation regarding the policy.
Yes.
Indeed, you are throw the light on the very important issue, which is a policy. But if you know that the policy means policymakers, and when we are talking about policymaker, we are talking about the political commitment.
Yes.
And indeed, we, as a biosafety and biosecurity expert in continent, we're facing many problems and many challenges. One of them is a lack of political commitment. So this is so we are aligned with your and your presentations regarding my previous experience, we are working in Egypt for a project funded by PEP. Indeed, normally it is funded for 1 year, but because COVID, we have expanded it for 3 years. This project aims to establish biosafety and biosecurity entity in Egypt, and the main objective of this entity is to oversight the national entity which handle or which addressing the high consequence agent and toxins. We trying to make screening of the all laws, regulations, and the guidelines in Egypt through more than 130 years. And yes, we go through this from 1889. So we go through these laws and regulation to find which of these laws relative to the dealing with infectious agents generally.
Yes.
And we're making a list of this, and we found gaps of this area. And we try from these gaps to focus on the we need. So we have gaps of laws, so we need to establish such kind of laws. And we invite many officials from different disciplinary, from Ministry of Health, from Ministry of Agriculture, Higher Education, etc., to let them know this is our gaps and we need to develop laws regarding this very important issue. And we also facing the problem. Some officials in some ministries hinders us and not efficiently or properly cooperate with us. So we finished the project by some conclusion and some outcomes, and we just conclude that we have the gaps, and we urgently need to put the law and regulation regarding biosafety and biosecurity generally, and on the oversight of the agent dealing with the HCAT pathogen. So I would like to thank you very much for this very important presentation.